Hello, Dr. Bouvier with Ask Dr. Bouvier. You came to the video to learn a little bit more about diabetes mellitus, diabetes type 2. So what is diabetes type 2? Technically, anything that has a blood sugar at fasting of 125 or more is diabetic. If you have an A1C that's 6.3 or more, you're diabetic. So when does diabetes start and when does it stop? So we got a thing called pre-diabetes, which is A1C of 5.6 to 6.3. But even before then, if your A1C is 5.5, does that mean you don't have diabetes? No, that means you're prone to it. Why do you want to wait until you go to 5.6 to actually get pre-diabetes and then go through 4, 5, 10 years and wait until you get to 6.2 of A1C and then finally trip over to 6.3 A1C and now you're diabetic? No, you're diabetic way back 10 years before. So how do you treat diabetes? What's the best way to treat diabetes before you even get it? Good question. Four pillars of health. We've talked about this before. So if I'm prone to diabetes or I have a family history, but I'm not quite there yet, my A1C is 5.4, how do I reverse it, that A1C to 5.2 or even 4.6? Four pillars of health. Okay, I'm the patient who went from last year I was 5.5 and my doctor told me that I should be checking my A1C every 6 months because I'm 45 years old. Last time it was 5.6, now it's 5.8. How do I treat it and get back into normal range of my A1C? Four pillars of health. Again, it's the same thing. It's not a pill, it's not a surgery, it's diet, exercise, get your sleep right, get your mental health right. The four pillars of health. So now I've had this pre-diabetes for 10 years and my A1C has finally climbed to 6.3. Now I have diabetes. How do I treat it? I don't want to go on insulin. I don't want to take the pills. You don't have to take the pills. Let's reverse your diabetes. It's on my marquee out front. How do I reverse my diabetes? Great question. I love that question. How do you treat it? Here we go again. Four pillars of health. It has nothing to do with medications or surgery. It's about eating right, daily exercise, not 3 times a week, daily exercise, getting your sleep right, and get your mental health stabilized. Say, yeah, but I'm a nervous Nelly. Stay for the next video and come and listen, and I'll do another video on what's the best treatment for anxiety and nervousness. Okay? Stay tuned for the next video, and we'll do that next week. Again, this is Dr. Bouvier. We've just a little hints about diabetes. If you have diabetes and you just learned about it, you've probably had it for 10 years, but you kind of buried your head, you didn't take care of it. What's the treatment? Again, it's the four pillars of health. Just get back to diet, exercise, get the sleep right and the mental health, and you're well on your way to good health. Again, this is Dr. Bouvier. I will give you the truth about healthcare.